So welcome. In today's session, we'll be looking at venous sinuses, and we will mention what are venous sinuses and some characteristics of venous sinuses, but specifically, we will look at the cavernous sinuses, okay? So welcome all, my name is Horace Munyiri, and I'm the redactor now. Venous sinuses. Now, the venous sinuses are formed in the following ways. One can be either by separation of the two layers of the cerebral dura. Remember, the cerebral dura had the meningeal layer and the endosteal layer. So when the two separate, they can form a venous sinuses, or by duplication of the inner meningeal layer of the dura. Those are the two ways in which venous sinuses are formed. Now, the venous sinuses are usually lined by endothelium, which is continuous with the endothelial lining of the veins. But let's look at now the general characteristics now. They are valveless, okay? No valves, so the flow of blood is bidirectional. It will depend on the local venous pressure. Also, they are devoid of the smooth muscle fibers in their walls. They have only the endothelium, but they don't have the tunica media or the tunica externa. You learn those when you are looking at the histology of the blood vessels. They don't have those, but they have the endothelium. They drain finally into the internal jugular veins. All of them will drain into the internal jugular veins, but we have some like the basilar venous plexus, which can communicate with the internal vertebral venous plexus. Now, they have cerebral, diploic, and some meningeal veins as their tributaries. Okay, they communicate via valveless emissary veins with the extracranial veins through scalp foramina. Okay. I hope you have looked at this scalp foramina, and for each scalp foramina you looked at, I'm sure you saw an emissary vein going through it. Now, classification of venous sinuses. They are either unpaired or paired. Okay. Now, for the unpaired one, you have the superior sagittal sinus, the inferior sagittal sinus, the straight sinus, the occipital sinus, the anterior and the posterior intercavernous sinuses. But for the paired ones, we have the sphenoparietal sinus, cavernous sinus, superior petrosal sinus, inferior petrosal sinus, the transverse sinuses, the sigmoidal sinuses. Okay. Now, here they are. Here is your superior sagittal, inferior sagittal. It will combine here with the great cerebral vein of Garen to form the straight sinus. Okay, here you have your transverse sinus. Okay, transverse sinus. Then where this is your superior petrosal sinus here. It will join the transverse sinus where it will end. So it usually join the transverse sinus at the end of transverse sinus and at the commencement of the sigmoid sinus. That is where the superior sagittal superior petrosal sinus will join. Then the inferior petrosal sinus will join where at the end of sigmoid sinus and at the commencement of the internal jugular vein. Okay. This is the confluence of sinuses, and I want you to go and look at the other name of confluence of sinuses. Now, cavernous sinus. They are usually located on either side of the ceratosica and the body of the sphenoid bone. Now, each sinus is a short, wide venous channel measuring about 2 centimeters anteroposteriorly and 1 centimeter transversely. Okay. It extends from the superior orbital fissure anteriorly to the apex of petrous temporal bone posteriorly. Okay, despite its name is like a misnomer. It is not a true cavernous. Okay, despite its name, despite its name, the cavernous sinus is usually a plexus. It is a plexus of veins, not a trabeculated venous space like the corpora cavernosa of the penis. Okay, it is not a trabeculated venous space. So it is not a true cavernous space because it is a plexus of veins. But that word still applies. Now, the two sinuses communicate with each other via the anterior and posterior intercavernous sinuses. Now, the anterior intercavernous sinus lies anterior to the infundibulum, and the posterior intercavernous sinus lies posterior to the infundibulum. Okay, which lie in the anterior and posterior margins of the diaphragma cell and pass anterior and posterior to the stalk of the pituitary gland, respectively. Now, the stalk of the pituitary gland is also known as the infundibulum. Now, here we are. This is your cavernous sinus here. Okay, and you can see it is extending from here. This is the location of the superior orbital fissure. Okay, and this is the apex of petrous temporal bone, and you can see some structures which traverse the superior orbital fissure there. Okay, and the apex of the petrous temporal bone is somewhere here. Okay, so from this is 2 centimeters anteroposteriorly and 1 centimeter transversely. Then you can see here you have the infundibulum. Here you have your anterior intercavernous sinus and your posterior intercavernous sinus. Okay, so now the cavernous sinuses together with these intercavernous sinuses, they form a structure known as the sulcus sinus. Okay, now the cavernous and the intercavernous sinuses together constitute the sulcus sinus. Now, how is it formed? How is the cavernous sinus formed? It is formed by the separation of the meningeal. So remember the 2 ways I told you how the sinuses are formed. This one in particular is formed by the separation of the meningeal and the endosterial layer of the dura mater, so that the roof, please note this, that the roof, the lateral wall, and the upper part of the medial wall is formed by the meningeal layer, but the floor is formed by the endosterial layer. Okay, the sinus is filled with the venous blood and is covered with an endothelial lining. Now, what are some relations of the cavernous sinus? Medial to the cavernous sinus, you have the pituitary gland and the body of the sphenoid bone containing the sphenoidal air sinuses. Okay, lateral to the cavernous sinus, you have the anchors of temporal lobe of the brain. You also have the trigeminal ganglion lining the cavum trigeminale. Cavum trigeminale is also known as your Merkel's cave. Okay, and but this lies in the posterior part of the cavernous sinus. Okay, it's like it is posterolateral. Okay, superior to the cavernous sinus, you have the upper limb of the U-shaped loop of internal carotid artery forming the carotid siphon. The carotid artery, the internal carotid artery, has a cavernous segment which usually traverses through the cavernous sinus. Then it pierces the roof of the sinus. Then it makes a U-turn. Okay, so that the upper limb of that U-turn is related superiorly to the cavernous sinus. Inferior to the cavernous sinus, you have the greater wing of the sphenoid bone. Now, each sinus is usually traversed by the internal carotid artery, now the cavernous portion of the cavernous segment of the internal carotid artery, with its sympathetic plexus around it. Remember, the sympathetic plexus here will be composed of a postganglionic sympathetic fibers originating from the superior cervical sympathetic ganglion. Also, the abducent nerve covered by an endothelium, and the abducent nerve will lie inferolateral to the artery. Okay. Then on the lateral wall, we have some structures, and that is, they lie between the endothelium and the meningeal layer of the dura mater. They will contain and they consist of oculomotor nerve being the highest, cranial nerve number 3, then trochlear nerve, then ophthalmic nerve, then maxillary nerve. Remember, ophthalmic and maxillary nerve are branches or divisions from the trigeminal nerve, your cranial nerve number 5. So here we are. Please, I urge you, this diagram, this, please understand them. So you can see within the cavernous sinus, you have the internal carotid, the cavernous segment. Then inferolateral, you can see this is inferior and lateral to the internal carotid artery. That is your abducent nerve, cranial nerve number 6. Okay. Then here these nerves, how I usually arrange them is this is number 3, 4, 5 part 1, 5 part 2. So 3, 4, 5 part 1, 5 part 2. 3 is oculomotor, 4 is trigeminal, 5 part 1, that is the first division of the trigeminal nerve, is ophthalmic nerve. Then the second division of trigeminal nerve is maxillary nerve. Okay, please note that the mandibular nerve, which is the third division of trigeminal nerve, does not traverse through the lateral wall of cavernous sinus. Please note that. Then you can see the medial relations. We have the pituitary gland within the hypophyseal fossa. Okay, then you have the sphenoid and the sphenoid air sinuses here. Okay, then laterally here you have the anchors of the temporal lobe, and also you have the trigeminal ganglion lying within the cavum trigeminale. Okay. Superiorly, you can see superiorly you have this, the upper limb of the U-shaped loop of internal carotid artery. Okay. So inferiorly you have here this is the greater wing of sphenoid bone. Then here, as you can see, let's go here. Here you can see that the lateral wall, the roof, and the medial wall here are being formed by the inner meningeal layer of dura mater, whereas the floor here is formed by the endosteal layer. Please note that. Okay. And please note this diagram will be, before you finish your anatomy, they will ask you that. Now, communications of the cavernous sinuses. Now, the cavernous sinus can communicate with the facial vein via 2 routes, either one via the superior ophthalmic and angular veins, also via the pterygoid venous plexus and the deep facial vein. Okay, so the facial vein can drain to the superior ophthalmic vein via the angular vein, and the superior ophthalmic vein will eventually drain into the cavernous sinus, or the facial vein can communicate with the pterygoid venous plexus via the deep facial vein, and the pterygoid venous plexus will communicate with the cavernous sinus via emissary veins, which will traverse some foramens such as the foramen ovale, the foramen spinosum, foramen basae, and the foramen lacerum. Okay. Also, it can communicate with the superior sagittal sinus through the superficial middle cerebral vein and the superior anastomotic vein of Troland. Okay, so the superior sagittal sinus via the superior anastomotic vein, it will drain into the superficial middle cerebral vein, and the superficial middle cerebral vein will eventually drain into the cavernous sinus. Okay, please note that it is first you start with the superior sagittal sinus, then blood will go to the superior anastomotic vein of Troland, then from that anastomotic vein to the superficial middle cerebral vein, then to the cavernous sinus. Now, can communicate with the pterygoid venous plexus through emissary veins passing through the following foramen: foramen ovale, spinosum, sacral, and lacerum. Okay. Then it can also communicate with the transverse sinus through the superior petrosal sinus. But I think these are the drainage from now the cavernous sinus. The superior petrosal sinus and the inferior petrosal sinus, they usually drain the cavernous sinus. They can also communicate with the internal vertebral venous plexus via the basilar venous plexus. Okay, please note this. This is very important, especially in cancer metastasis, where even breast cancer can metastasize all the way to the brain via the internal vertebral venous plexus. You will see that we have a part of the breast is usually drained by I think you have done the breast. You can see that a part of the breast is usually drained by the posterior intercostal veins, which can communicate with the external vertebral venous plexus, and there are some veins which allow communication between the external vertebral venous plexus with the internal vertebral venous plexus, and that's how the cancer can metastasize all the way from the breast to the brain. Okay. Now it also communicates with the opposite cavernous sinus via the anterior and posterior intercavernous sinuses. Now, tributaries of the cavernous sinus. They will receive blood from the superior ophthalmic vein, which is often rejoined by the inferior ophthalmic vein. Also, it will receive from the inferior ophthalmic vein if it had not joined the superior ophthalmic vein. Also, sometimes the central vein of retina can also drain blood into the cavernous sinus if it had not joined the superior ophthalmic vein. Also, the superficial middle cerebral vein. Remember, the superficial middle cerebral vein communicates with the superior sagittal sinus via the superior anastomotic vein of Troland. Also, it communicates, I think, with the transverse sinus via the inferior anastomotic vein of Labbe. Please correct. It also a few inferior cerebral veins drain into the cavernous sinus. The sphenoparietal sinus will drain into it. Sometimes the anterior frontal trunk of middle meningeal vein, if it does not drain into the pterygoid venous plexus, it will drain into the cavernous sinus or into the sphenoparietal sinus. Okay, and the sphenoparietal sinus is a tributary to the of the cavernous sinus. Now here we are in this color. Don't express that. Okay, these are the tributaries, and the tributaries come from 3 areas, either from the orbit, from the meninges, and from the brain. From the orbit, we have the superior anastomotic vein, superior ophthalmic vein, also inferior ophthalmic vein, and the central vein of retina. Okay, remember the inferior ophthalmic vein and the central vein of the retina, they usually join the superior ophthalmic vein and drain as one, but in others, they can drain individually. Now, from the meninges, you have the sphenoparietal sinus and the middle meningeal vein is in the frontal trunk if it does not drain into the pterygoid venous plexus. But the frontal trunk can also drain first into the sphenoparietal sinus, then eventually into the cavernous sinus. Now, from the brain, we have the superficial middle cerebral vein, okay, and the inferior, some few inferior cerebral veins. Then the draining channels are to the superior petrosal sinus, which drains into the sigmoidal sinus, and the inferior petrosal sinus into the internal jugular vein. Then it can communicate one via the facial vein. Facial vein can communicate with the superior ophthalmic vein via the angular vein, or the facial vein can communicate with the pterygoid venous plexus via the deep facial vein, and the pterygoid venous plexus will communicate with the cavernous sinus via emissary veins which traverse through the foramen ovaris and the foramen rasceram spinosum, just to mention a few. Okay. Also, the basilar venous plexus, okay, can communicate with the cavernous sinus, and the basilar plexus also communicates with the internal vertebral venous plexus, which I said freely communicates with the external vertebral venous plexus, which communicates with the posterior intercostal veins. And the posterior intercostal veins drain, I think they usually drain the lower outer quadrant, of the breast. And that's how cancer can metastasize all the way from the breast to the brain. Okay, because remember, these plexuses are in valveless, so flow of blood is bidirectional. So let's look at some clinical correlations as we wind up. Now we have cavernous sinus thrombosis. Now the infection, an infection reaching the cavernous sinus via emissary veins from the face, either from the face, scalp, and the paranasal sinuses, especially the sphenoidal air sinus, may cause cavernous sinus thrombosis, which presents with the pain in the eye, total ophthalmoplegia due to involvement of the cranial nerve number 3, 4, and the 6, the oculomotor, trochlea, and the abducent, okay, which are present within remember, 3, cranial number 3 and 4 are present on the lateral wall, but cranial number 6, the abducent, is within the cavernous sinus. So when involved, it will lead to ophthalmoplegia, okay? And there will also be marked edema of the eyelids due to congestion of the veins which drain the orbit, okay? I will show you that. And we have an area of the face known as the danger area, the danger triangle, the face, or the death triangle. I will show you that, and I will explain why it is called as the danger triangle of the face. Now, pulsating exophthalmos. Okay. Now, when one has a fracture in the base of the skull, the internal carotid artery may rupture within the cavernous sinus. Remember, we have the cavernous segment of the internal carotid artery. If that cavernous segment ruptures, it will produce an arteriovenous fistula. Okay, so consequently, the arterial blood will rush into the cavernous sinus, enlarging it and forcing its blood into the communicating veins. Okay, as a result, the eyeball will protrude exophthalmos, and the conjunctiva becomes engorged, what is known as chemosis, and on that side of injury. Okay, so if it is the right, the ipsilateral side is the one which will be affected. Okay, interestingly, in these circumstances, the bulging eye usually pulsates in synchrony with the radial pulse, producing a clinical condition known as pulsating exophthalmos. Okay, so let me show you this. This is what I was telling you, the danger triangle of the face, or the death triangle. Why? Because infections in this area you can see here is drained by the facial vein, and the facial vein in this area can communicate either with the superior ophthalmic vein via the angular vein, or can communicate with the pterygoid venous plexus via the deep facial vein. Remember, the superior ophthalmic vein will drain directly into the cavernous sinus, and if there is an infection, it will lead to cavernous thrombosis. Okay, and if the infection was spread to the pterygoid venous plexus via the deep facial vein, it will eventually reach the cavernous sinus via the emissary vein, traversing the several foramina which I had said earlier, such as foramen ovale, spinosum, vacale. Okay, and it will lead to cavernous thrombosis. Okay, and you can see there is a marked edema. Okay, You see there is very marked edema here of the eyelids due to congestion of the orbital veins. Okay, and this it is usually fatal. Okay, if this thrombosis spreads to other areas, it is very fatal. Okay, so okay, and there will be total ophthalmoplegia due to involvement of the cranial nerves number 3, number 3, 4, and 6. Okay, now pulsating exophthalmos. Let me show you that. Okay, I don't know why this. I had the video here. Okay, I want you to look at this patient eye, right eye. You can see it is pulsating. Okay, it is somewhat bulging. Okay. Now I want you to see the left eye. You can see the left eye is normal. Okay, so this patient, it is the right. Maybe the patient had a fracture. Fracture at the base of the skull on the right side, leading to the rupture of the right internal carotid artery at the cavernous segment, hence an atriovenous fistula, which will lead to the pulsating exophthalmos. Let's have another look. You can see. And these pulsations are in synchrony with the radial pulse. Okay, as it is pulsating, but the left eye is quite normal. But if you look at the right eye, yes, it is pulsating. So this the carotid, the cavernous segment of the carotid, internal carotid artery of this side is the one which has ruptured. Okay, so that is that. I think I don't have anything else. Okay, I've seen that. So that's all for today, and have a good day. In fact, I'm recording this at night, but have a good day, and please don't forget to subscribe to my YouTube channel for more content. Thank you.